Every day, thousands of people are injured or killed during the accidents. Accidents will always happen despite any preventive or protective measure, care, or procedure. Do you know that your brain is in the center of everything you do? Your ability to think, talk, feel, sing, lie, or even dance all goes back to your brain. And those brain cells need oxygen. Brain use 20% of oxygen, but there is no storage tank. It needs a steady flow of blood to work well. Brain cells start to die if they go without oxygen 3 to 4 minutes. After 4 minutes, every single minute you are losing 2 million brain cells. The longer you go, the greater will be the chance for brain damage that can't be undone. Everyone should learn at least basic first aid technique. No one never know when and where someone might need these techniques. You could be at home or at work, in the school or on holiday. Maybe next to you is your father, brother, or a friend in life-threatening situation. If you will not act, he or she will be no more. You could be the difference between his life and death. So take some time to learn first aid and CPR. It saves lives and it works. You are watching Safety First, and I'm your host, Javed Said. Today's HSC tutorial topic is basic first aid. If you are new on this channel, kindly subscribe and share. Let us see what are the basics of first aid. Prior to jump on the topic, remember this presentation is not intended as a substitute for professional medical care. It is just an effort or attempt to make you thinking in a different way. What is first aid? The immediate care or attention given to a person who has been injured or who has become ill. If you are the first on the scene of accident that results in an injury or serious illness, you may be the only link between a victim and emergency medical care. Your role is to take action, whether by providing first aid, seeking medical help, or calling the emergency services. Your action may improve the victim's chance of recovery and saving his life. Main purposes and aim of the first aid is 3 P's. Don't forget 3 P's. Number one, preserve life. Number two, prevent deterioration. Number three, promote recovery. Remember, if you have not contacted the emergency services, then they will not arrive and you are in trouble. The person nearby you is in life-threatening situation. What are the responsibilities of first aider? Ensure first aid equipment is fit for purpose and it should be checked all around every day before jumping in. Ensure the scene is safe. Contact the emergency services. Prioritizing the treatment of casualties. Clearing up after the first aid. Incident reporting and record keeping. The last point is related to the first aider who is working in the construction company. Might be a foreman, any worker, might be a safety officer. Incident reporting and record keeping as a part and parcel of HSC. Protective equipment. Barrier devices are essential equipment and help to eradicate the spreading of infection and cross-contamination. Barrier devices, as their name suggests, place a barrier between the first aider and the casualty. Barrier devices might include nitrile powder-free gloves, face shields, pocket masks. While arriving at the scene, control the situation calmly, identification of potential hazards, and how to deal them. This should be in the mind of first aider. Ensure your own safety and the safety of bystanders. Gather the information from the scene. Bystanders and inform to emergency response team or the medical services. Prioritize and start. While communicating with emergency response team, first aider will either contact the emergency services themselves or instruct a bystander to do so. Contacting the emergency services at the earliest opportunity is paramount. When contacting the emergency services, it is important that the information given is clear, concise, and sufficient. This can be achieved by remembering the term, line, location, incident, number of casualties, and extent of their injuries. First aider have to set the priorities order. Basic life support, shock, bleeding, soft tissue injuries, bones, joints and muscles, burns, poisoning. Priorities order might be changed as per the site condition, as per the nature of accident. Breathing, bleeding, shock, shocking, burns, damage to bones, skin conditions are others. A, B, C, D. Basic life support having consists of four main components: airway, breathing, circulation, defibrillation. How to check response? If possible, approach the casualty from their feet, as this prevents hyperextension of the neck from the responsive casualty. Are you all right? Use the AVPU scale when checking for the response. What is AVPU? Approaching the victim. A for alert. Is casualty moving? No. Proceed to V. V for voice. Does the casualty respond to speech? No. Proceed to P. P for place. Place your hands on the casualty shoulders and gently shake them. Ask loudly, are you all right? If no response, proceed to U. U means unresponsive. Assume the casualty is unresponsive. Now open the airway using the head tilt, chin lift method. Airway obstruction might be partial or complete. What is airway obstruction? Airway obstruction, also known as choking. Choking occurs when the airway becomes blocked. If the casualty can cough forcefully and is able to speak, encourage him or her or to continue coughing in an attempt to dislodge the object. This is partial. Complete airway obstruction and inability to speak, cough, or breathe. If the casualty is conscious, he or she may display the universal distress signal. Complete airway obstruction, choking. If the person is conscious, are you choking? You have to ask the question. Stand behind the casualty. Place your arms around the casualty waist with your fist. Place the thumb side against the middle of the abdomen, above the navel and below the tip of the breastbone. Grasp your fist with your other hand, keeping your elbows out. Press your fist into the abdomen with a quick upward thrust. Repeat until the obstruction is clear or the casualty becomes unconscious. If the casualty is unresponsive or unconscious, choking, request medical assistance. Lower them to the ground. Open the airway, remove the object if you can see it. Head tilt, chin lift. Attempt 2 breaths, then begin CPR. 30 compressions by 2 breaths. Every time you open the airway to give breaths, look for the object, then continue CPR. 30 into 2, 30 compressions, 2 rescue breaths. If the choking is in the infant and the infant is conscious, alternate 5 back blows and 5 chest thrusts until object is removed or the victim becomes unresponsive. If the infant is unconscious and there is choking, request medical assistance. Call the doctor. Place them on the hard flat surface. Every time you open the airway to give breath, look for the object, then continue CPR. What is CPR? Cardiopulmonary resuscitation. One rescuer CPR sequence, check for the responsiveness. If no response, call for medical assistance. Give 30 chest compressions. Open the airway, head tilt, chin lift method. Look, listen and feel for breathing. No breathing, give 2 breaths. Ensure chest rise with each breath. Take 5 to 10 seconds to check for breathing and pulse. Continue 30 compressions and 2 breaths until the AED, automated external defibrillator, arrives. Emergency life support takes over or the victim moves. You need to continue the CPR. Allow chest to recoil completely or return to the normal position. 30 compressions, 2 breaths, 5 cycles. You need to complete it 2 minutes. Compression ratio is, once you are going to compression, mean once you are pressing the chest, it should be minimum 1.5 inch and maximum 2 inches down. If you are doing CPR for the child, the only difference for adult and child is adults you need to make 30 compressions true breath. For child and infant, you need to make 15 compressions and true breath. Let us look what is shock. Shock is the failure of the heart and blood vessels to maintain enough oxygen and blood flowing to the vital organs of the body. Usual signs and symptoms: anxiety, restlessness and fainting or vomiting, excessive thirst, shallow, rapid and irregular breathing, pale cold skin, weak, rapid or absent pulse. These are the symptoms or the signs of shock. What are the types of shock? Hypovolemic, caused by a decreased amount of blood or fluids in the body by 20%. This decrease results from injuries that produce internal or external bleeding, fluid loss due to burns, and dehydration due to severe vomiting or diarrhea. What is neurogenic shock? Caused by an abnormal enlargement of the blood vessels and pooling of the blood to a degree that adequate blood flow cannot be maintained. That is neurogenic shock. What is psychogenic shock? Shock-like condition produced by excessive fear, joy, anger, or grief. That is psychogenic. Anaphylactic shock. Anaphylactic allergic shock occurs when an individual is exposed to a substance to which his or her body is sensitive. Individual may experience itching, hives, severe swelling, or difficulty breathing. The causative agents are injection of medicine, venoms by stinging insects and animals, inhalation of dust or pollens, and ingestion of certain foods and medications. What's the treatment of shock? To provide first aid for shock, do the following: maintain open airway by using head tilt, chin lift, or jaw thrust method, control bleeding, direct pressure, elevation, indirect pressure, or tourniquet. Place the casualty on his or her back with legs elevated 6 to 12 inches. If you suspect head or neck injuries or unsure of the casualty's condition, keep them laying flat. Splint, suspected broken and dislocated bones. Keep the casualty comfortable and warm enough to maintain normal body temperature. Keep the casualty as calm as possible. Give nothing by mouth. Call for medical assistance. If the casualty is not conscious, put the casualty on the recovery position. This is part one of this presentation. But for the site workers, for the site first aiders, they never forget to record the incident and to maintain the record. After any first aid incident, it is important that it is recorded and reported in full. The accident record should be completed with clear and concise information. Remember, it shall be distributed as per the law of the land to the concerned regulatory bodies and authorities. For example, in UAE, there is OSHAD Form G, Serious OHS Incident Notification, version 3. OSHAD Form G1, Serious OHS Incident Investigation Report. Form G2, Non-Serious OHS Incident Investigation Report. Remember, life is 10% what happens to you, and 90% how you respond to it. Love yourself. Everyone else is already taken. You have brain in your head. You have feet in your shoes. You can steer yourself in any direction, but choose the right way and make an impact. Love and live in your own dreams, not in fears. Be a stubborn, but don't forget, it takes years to build a reputation and only minutes to ruin it. That's all in the part one. Part two includes bleeding, types of bleeding, types of wounds and fractures, burns, degrees of burns, poisons, snake biting, electrical shock, and heart attack. What are the signs and symptoms? And what is the initial treatment as a first aider? So don't forget to watch part two. Thanks for training session.